So when electronic cigarettes first entered the market in 2011, they were ostensibly going to be used for people that were traditional combustible tobacco smokers, cigarette smokers, to help them quit, to help them stop using tobacco. However, what happened over time was that these devices evolved and developed into much sleeker looking devices that then were paired up with different flavorings. And to date, there's about 15,000 different flavorings, everything from Skittles flavor, cotton candy flavor, and it looks like about 60% of the adolescents that start using these electronic vaping devices don't know that they actually contain nicotine. So what we can guess is that although electronic vaping devices, perhaps known colloquially as juuling, that these companies that made them, we know that they were hoping that they would have traditional combustible tobacco smokers quit using cigarettes, that they were hoping they would go on to an electronic cigarette and be using that for life. We also suspect that because of the flavoring and because of the social network marketing that they were using, that they knew very well that they were hoping to recruit a non-user to start using a nicotine-containing device. And with time, nicotine is one of the most addicting substances. The FDA tells us that after heroin and cocaine, that nicotine is the third most powerfully addicting drug. They're young, healthy, no medical history. They usually have, on average, about a week of illness before they're sick. About half of them have GI, nausea, vomiting, diarrhea, and then about 80–90% of them shortness of breath, chest pain. They arrive with fever, high heart rate, high breathing rate, low oxygen saturation. They can hardly walk across the room, they're so short of breath. And they get admitted with these terrible looking chest x-rays, often to the ICU, and about a third of them getting intubated, mechanically ventilated. And they have a completely negative infectious workup, so it's not an infection, it's some sort of lung injury associated with something that's either in the device or in the liquid or in the substance that's being inhaled. So we've just now started to have some policies and thinking, how do we address this? And I think first and foremost is making sure that the public is aware that these are not harmless devices, that they are not safe devices, that they are not a water vapor, they're actually an aerosol, and they aerosolize all kinds of components, including heavy metals from the coils where the liquids are heated up, to substances that are fine when you eat them, like vegetable glycerin and propylene glycol, to even other things like benzoic acid, which is, unfortunately, when you inhale it, a carcinogenic. I would say we'll just start now to see there's going to be some interventions to help young people, in particular, address how do they quit using their electronic device, or how do they quit, colloquially using the juuling term. So what we've seen as far as helping along the process of hopefully figuring out why people are getting so ill is we've seen certain states legislate either no more flavorings in them that might be something that would be attractive to a younger crowd or a crowd that doesn't use traditional cigarettes. And we've also seen state of Massachusetts, for example, actually put a ban on the sale of them for 4 months, hoping to try to characterize more what it is exactly that's causing the electronic and vaping associated lung injury cases, of which we've had about 1,500 to date. We're prepared as a healthcare service for our students. We're prepared during the coming months, when we're going to be seeing a lot more flu cases and upper respiratory infections, to have to ask each and every person if they've had any upper respiratory symptoms like cough, shortness of breath, fever, as well as any other GI symptoms, and to ask them if they use any vaping devices. And we are prepared that some people might be needing to go off to an emergency room for further evaluation and management, and that all our providers need to be on the same page about asking each person non-judgmentally if they're using the electronic or vaping devices. One of the things we're hoping to do is to start having a dialogue. So trying to have some posters and some more dialogue, even with social media, so that we can get not just students talking to each other, but also to us as healthcare providers, because we can help them if they're really struggling with stopping their vaping device with various FDA-approved ways. There are even some really wonderful apps that give people reminders via text and other things on how to quit vaping. So we're hoping, and I believe we will connect with our students, because I think they really do want to be healthy. I believe they do have that inner moral compass about being their best, healthiest person.